Page 79. Ampicillin sodium. The sodium salt of ampicillin prescribed as an antibiotic to treat gram-positive organisms and some gram-negative organisms. Amplification, Latin amplificare, to make wider. 1. In molecular genetics, a process in which the amount of plasmid deoxyribonucleic acid DNA is increased in proportion to the amount of bacterial DNA by treatment with certain substances, including chloramphenicol. 2. The replication in bulk of an entire gene library. See also polymerase chain reaction. Amplify, verb. Amplifier. A device that controls power from a mechanical, electrical, hydraulic, or other source so that the output is greater than the input. Amplitude. Latin amplus, wide. Width or breadth or of range or extent, such as amplitude of an accommodation or amplitude of convergence. Amplitude of accommodation, AA. A total accommodative power of the eye determined by the difference between the refractive power for furthest vision and that for nearest vision. Amplitude of convergence. The difference in the power needed to turn the eyes from their far point to their near point of convergence. Also called fusional amplitude, vergence ability. Ampule, French, ampoule, fiel. A small sterile glass or plastic container that usually contains a single dose of solution, also called ampoule. Ampulla, Latin flask-like bottle. A rounded sac-like dilation of a duct, canal, or any tubular structure such as lacrimal duct, semicircular canal, uterine tube, rectum, or vas deferens. Ampulla of rectum, a flask-shaped dilation near the end of the rectum. Ampulla of the bile duct. See hepatopancreatic ampulla. Ampulla of Vader. The hepatopancreatic ampulla. Ampullary aneurysm. The saccular aneurysm. Ampullary tubal pregnancy. A kind of tubal pregnancy in which implantation occurs in the ampulla of one of the fallopian tubes. See also tubal pregnancy. Ampullula. A spherical dilation of a minute lymph or blood vessel or duct. Compare ampulla. Amputation. Latin amputare, to excise. The surgical removal of a part of the body or limb or part of a limb. It is performed to treat recurrent infections or gangrene or peripheral vascular disease, to remove malignant tumors, and to treat severe trauma with a patient under anesthesia. The part is removed and a shaped flap is cut from muscular and cutaneous tissue to cover the end of the bone. A section may be left open for drainage if infection is present. Preoperative care includes an assessment of circulation in the affected part. After surgery, a lower leg amputation is elevated on a pillow for no more than 24 to 48 hours, and if necessary, protected with plastic from urinary and fecal contamination. Vital signs are monitored carefully. If a soft dressing is used, it is watched for excessive bleeding. The stump is removed frequently to prevent circulatory complications, contractures, and tissue necrosis. If the dressing is rigged, a cast, it must remain in place for 8 to 14 days. Should the cast come off accidentally, the stump must be wrapped tightly at once with an elastic compression bandage, and plans must be made to replace the cast. With the cast on, the patient who has had part of a leg removed can stand briefly after 24 hours and bear some weight on a prosthesis. Medication may relieve incisional and phantom limb pain. Kinds of amputation include closed amputation, congenital amputation, open amputation, primary amputation, and secondary amputation. Amputation care. A nursing interventions classification defined as the promotion of physical and psychological healing after amputation of a body part. See also nursing interventions classifications. Amputation flap. A flap of skin used to cover the end of the amputation stump. Amputation neuroma. A form of traumatic neuroma that may develop near the stump after the amputation of an extremity. Amputation stump bandage. An elastic figure of 8 bandage applied to cover the stump after an amputation. It helps control edema and shape the remaining portions of the limb. See figure page 80. Amputee. A person who has had one or more extremities traumatically or surgically removed. See also congenital amputation. AMRA, abbreviation for American Medical Records Association. Amrinone lactate, an intravenous cardiac enteropic drug. Indications: it is prescribed in the short-term management of congestive heart failure in patients who do not respond in therapy with digitalis, diuretics, and vasodilators. Contraindications: concomitant use with disopyramide and any combination therapy should be closely monitored for potential interactions. Adverse effects: among the more serious adverse reactions are thrombocytopenia, arrhythmias, hypotension, nausea, vomiting, liver impairment, and hypersensitivity effects. Amsler grid. Mark Amsler, Swiss ophthalmologist, 1891 to 1968. A checkerboard grid of intersecting dark horizontal and vertical lines with one dark spot in the middle. To discover a visual field defect, the person simply covers or closes one eye and looks at the spot with the other. A visual field defect is perceived as a defect, distortion, blank, or other fault in the grid. The person may record the defects directly on a paper copy of the grid that may be kept as a permanent record. AMT, abbreviation for American Medical Technologists. AMU, abbreviation for Atomic Mass Unit. Amusia, 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 a loss of the ability to recognize melodies. The neurologic defect may follow a cerebrovascular accident or other damage to the parietal lobe of the brain. Amelia, the absence of a spinal cord. Amelia, amelianic neuroma. Greek, mylos, without marrow, neuron, nerve, oma. A tumor that contains only non-myelinated nerve fibers. Amygdala, Greek, amygdale, almond. An almond-shaped mass of gray matter in the front portion of the temporal lobe of the brain that may play a major role in memory processing. Amygdalin, Greek, amygdale, almond. A naturally occurring cyanogenic glycoside obtained from bitter almonds and apricot pits. It has been promoted as a potential cancer remedy under the trademark of Laetrile, also called vitamin B17. Amygdaloid, resembling a tonsil. Amygdaloid fossa, Greek, amylin, Edo, starch-like, Latin, fossa, ditch. A space in the wall of the oropharynx between the pillars of the fosses that is occupied by the palatine tonsil, also called tonsillar fossa. Amygdaloid nucleus, Greek, amygdale, almond, Edos form, Latin, nucleus, nut. One of the basal nuclei found in the inferior horn of the lateral ventricle. Amyl, see also amylo. Amyl alcohol, Greek, amylon, starch, a colorless, oily liquid that is only slightly soluble in water but can be mixed with ethyl alcohol, chloroform, or ether. Amyl alcohol tertiary, see amylene hydrate. Amylase, Greek, amylon, starch, an enzyme that catalyzes the hydrolysis of starch into smaller carbohydrate molecules. Alpha amylase, found in saliva, pancreatic juice, malt, certain bacteria, and molds, catalyzes the hydrolysis of starch in dextrins, maltose, and maltodextrin. Beta amylase, found in grains, vegetables, and malt, is involved in the hydrolysis of starch to maltose. Normal blood findings are 56 to 190 IU/L. See also enzyme. Amylene hydrate, a clear, colorless liquid with a camphor-like odor, miscible with alcohol, chloroform, ether of glycerin, and used in a solvent and a hypnotic. Amylic formation, the formation of amyl alcohol from sugar. Amyl nitrate, a vasodilator, indications that it is prescribed to relieve the vasospasms of angina pectoris and cyanide poisoning. Contraindications, known hypersensitivity to this drug or to other nitrates prohibit its use. Adverse effects, among the serious adverse reactions are hypotension, allergic reactions, nausea, headache, and dizziness. Amyl, combining foreign meaning starch, amylodextrin, amylase, amylobarbital, see amylbarbital. Amyloid, Greek amylon, starch, eidos, form 1 pertaining to or resembling starch, 2 a starch-like protein carbohydrate complex that is deposited abnormally in some tissues during certain chronic disease states such as amyloidosis, rheumatoid arthritis, tuberculosis, and Alzheimer's disease. Amyloid disease, see amyloidosis. Amyloid liver, Greek amylon, starch, eidos, form AS, lifer, liver in which the cells have been infiltrated with amyloid deposits, also called albuminous liver. Amyloidosis, Greek amylon plus eidos, form osis condition, a disease in which a waxy starch-like glycoprotein amyloid accumulates in tissue and organs, impairing their function. There are two major forms of the condition. Primary amyloidosis usually occurs with multiple myeloma. Patients with secondary amyloidosis usually suffer from another chronic infectious or inflammatory disease, such as tuberculosis, osteomyelitis, rheumatoid arthritis, or Crohn's disease. The cause of both types of amyloidosis is unknown. Almost all organs are affected, most often the heart, lungs, tongue, and intestines, and primary amyloidosis in kidneys, liver, and spleen. In the secondary type, elderly patients tend to experience cardiac effects of the disease. Diagnosis is made through biopsy of the suspected organ. There is no known cure for the amyloidosis, and treatment is the secondary type is aimed at alleviating the underlying chronic disease. Patients with renal amyloidosis are frequently candidates for kidney dialysis and transplantation. Amylolysis, Greek amylon, starch, lysis, loosening, the digestive process whereby starch is converted into sugars and dextrins by hydrolysis or by enzymatic activity. Amylopectinosis, see Anderson's disease. Amyoplasia congenita, see arthrogryposis multiplex congenita. Amyotonia, Greek myos, not muscle, tonos, tone, an abnormal condition of skeletal muscle characterized by a lack of tone, weakness, and wasting, usually the result of a motor neuron disease. See also myotonia. Amyotonic adjective. Amyotrophic lateral sclerosis, ALS. Greek mis plus trophy, nourishment, a degenerative disease of the motor neurons characterized by weakness and atrophy of the muscles of the hands, forearms, and legs, spreading to involve most of the body and face. It results from degeneration of the motor neurons of the anterior horns and corticospinal tracts, beginning in middle age and progressing rapidly, causing death within 2 to 5 years. There is no known treatment. Also called Lou Gehrig's disease, wasting palsy. See also Aaron-Duchenne muscular atrophy. Amytal sodium, trademark for barbiturate, sodium amylbarbital. Ana, prefix meaning not without. Anoxia, analgesia. Ian, suffix meaning belonging to, characteristic of similar to protozoan, selpinigian. Ana, ANA. In prescriptions, so much of each, an indication of the amount of each ingredients to be compounded, usually written as an abbreviation. ANA, 1. Abbreviation for American Nurses Association. 2. Abbreviation for anti-nuclear antibody. Ana, see An. Anabolic, see anabolism. Anabolic steroid, Greek anabolium, to build up. Any one of several compounds derived from testosterone or prepared synthetically to promote general body growth, to oppose the effects of endogenous estrogen, or to promote masculinizing effects. All such compounds cause a mixed androgenic anabolic effect. Indications. Anabolic steroids are prescribed in the treatment of aplastic anemia, red cell aplasia, and hemolytic anemia, and in anemias associated with renal failure, myeloid metaplasia, and leukemia. Contraindications. They are contraindicated in palliation of carcinoma of the breast and pregnancy and serious cardiac, renal, and hepatic diseases, and with known hypersensitivity. Adverse effects. Among the most serious adverse effects are acne, growth of facial hair, and hoarsening or deepening of the voice. Other masculinization features are common. Continued use of these compounds in women may also produce prominent musculature, excessive body hair, and hypertrophy of the clitoris. Anabolism, Greek anabolene, to build up. Constructive metabolism characterized by the conversion of simple substances into the more complex compounds of living matter. Compare catabolism and anabolic adjective. Anabolite, Greek anabalion, to build up. A product of the process of anabolism. Anacatadidymis, Greek ana, up, cata, down, didymus, twin. Conjoined twins that are fused in the middle but separated above and below. Anaclysis, Greek ana plus clysis, leaning. 1. A condition normal in childhood but pathologic in adulthood, in which a person is emotionally dependent on other people. 2. A condition in which a person consciously or unconsciously chooses to love object because of a resemblance to the mother, father, or other person who was an important source of comfort and protection in infancy. Aneclectic, adjective. Aneclectic depression, a syndrome occurring in infants, usually after sudden separation from the mothering person. Symptoms include apprehension at withdrawal, detachment, incessant crying, refusal to eat, sleep disturbances, and eventually stupor, leading to severe impairment of the infant's physical, social, and intellectual development. If the mothering figure or a substitute is made available within 1 to 3 months, the infant recovers quickly with no long-term effects. See also hospitalism. Anacrotic, pertaining to anacrotism, or a pulse with more than one expansion of the artery and is observed as a double heartbeat. Anacrotic pulse, Greek ana plus krotos, stroke, on a sphygmographic tracing, a pulse characterized by a transient drop in amplitude on the curve of the primary elevation. A notch, it is seen in valvular aortic stenosis. Anacrotism, Greek anakrotos, stroke, a condition characterized by two arterial expansions per heartbeat and observed as a notch on the ascending limb of an arterial pulse pressure tracing. Anacusis, Greek akuion, not to hear, a total loss of hearing. Anadicrotic pulse, Greek ana plus dis twice, protostroke, on a sphygmographic tracing, a pulse characterized by two transient drops in amplitude on the curve of primary elevation. Anadidymus, Greek ana plus didymos, twin, conjoined twins that are united at the pelvis and lower extremities but are separated in the upper half, also called duplicatus anterior. Anadipsia, Greek ana plus dipsa, thirst, extreme thirst, often occurring in the manic phase of bipolar mood disorder. The condition is the result of dehydration caused by the excessive perspiration, continuous urination, and relentless physical activity produced by the intense excitement, a characteristic of the manic phase. See also polydipsia. Anadrol 50, trademark for an androgen oxymethylone. Anemia, see anemia. Anaerobe, Greek a plus air, not air, bios, life. A microorganism that grows and lives in the complete or almost complete absence of oxygen. An example is Clostridium botulinum. Anaerobes are widely distributed in nature and in the body. Types include the fasculative anaerobe and the obligate anaerobe. Compare aerobe, microaerophile. See also anaerobic infection. Anaerobic, 1. Pertaining to the absence of air or oxygen. 2. Able to grow and function without air or oxygen. Anaerobic catabolism, the breakdown of complex chemical substances into simpler compounds with the release of energy in the absence of oxygen. Anaerobic exercise, muscular exertion sufficient to result in metabolic acidosis because of an accumulation of lactic acid as a product of muscle metabolism. Compare aerobic exercise. See also active exercise, passive exercise. Anaerobic glycolysis. See glycolysis. Anaerobic infection, an infection caused by an aerobic organism, usually occurring in deep puncture wounds that exclude air or in tissue that has diminished oxygen reduction potential as a result of trauma, necrosis, or overgrowth of bacteria. Kinds of anaerobic infection are gangrene and tetanus. See also Clostridium. Anaerobic myositis. Myositis. See gas gangrene. Anesthesia. See anesthesia. Anesthetic. See anesthetic. Anesthetist. See anesthetist. Antigen. See hair. Anakit. Trademark for an insect sting treatment kit containing epinephrine in a sterile 1 milliliter syringe. Anal. See anus. Pertaining to the anus. Anal agnesis. See imperforate anus. Anus canal, the final portion of the alimentary tract about 4 centimeters long between the rectum and the anus. Anal character. And psychoanalysis, a kind of personality exhibiting patterns of behavior originating in the anal phase of childhood. It is characterized by extreme odorliness, obstinacy, perfectionism, cleanliness, punctuality, and miserliness, or their extreme opposites, also called anal personality. See also anal stage. Psychosexual development. Anal column, the highly vascular longitudinal folds of the anal canal in which are found the hemorrhoidal blood vessels. Anal crypt, the depression between rectal columns that enclose networks of veins that, when inflamed and swollen, are called hemorrhoids. Analeptic, see central nervous system stimulant. Anal eroticism. In psychoanalysis, libidinal fixation at or regression to the anal stage of psychosexual development, often reflected in such personality traits as miserliness, stubbornness, and over-scrupulousness, also called anal eroticism. Compare oral eroticism. See also anal character. Anal fissure, a painful linear ulceration or laceration of the skin at the margin of the anus, also called fissure in anal. Anal fistula, an abnormal opening on the cutaneous surface near the anus, usually resulting from a local crypt, abscess, and also common in Crohn's disease. A perianal fistula may or may not communicate with the rectum, also called fistula in anal. Analgesia, Greek a algos without pain, decreased or absent sensation of pain. Analgesic, one relieving pain, two a drug that relieves pain. The narcotic analgesics act on the central nervous system and alter the patient's perception. They are more often used for severe pain. The non-narcotic analgesics act primarily at the periphery, do not produce tolerance or dependence, and do not alter the patient's perception. They are used for mild to moderate pain. See also pain interventions. Analgesic administration, a nursing interventions classification defined as use of pharmacologic agents to reduce or eliminate pain. See also nursing interventions classifications. Analgesic administration interspinal, a nursing interventions classification defined as an administration of pharmacologic agents into the epidural or intrathecal space to reduce or eliminate pain. See also nursing interventions classification. Analgesic nephropathy, Greek a algos without pain, nephros kidney, pathos disease, kidney damage resulting from the consumption of excessive amounts of aspirin or similar analgesic medications. Analgesia, ana without algos pain, an absence of pain. Anal incontinence, Latin anus incontinentia, an inability to retain, the lack of voluntary control over a fecal discharge. Anal membrane, see cloacal membrane. Anal membrane atresia, see imperforate anus. Analog, Greek, analogous, proportionate. One, a substance, tissue, or organ that is similar in appearance or function to another, but differs in origin or development, such as the eye of a fly and the eye of a human. Two, a drug or other chemical compound that resembles another in structure or constituents, but has different effects. Also spelled analog. Compare homolog. Analog computer, a computer that processes information as a physical quantity such as voltage, amperage, weight or length, and presence results of calculations that can be continuously varied and measured. Compare hybrid computer. Analogous, Greek analogous, proportionate, similar in function but different in origin or structure such as wings of birds and flies. Analog signal, a continuous electrical signal representing a specific condition such as temperature or electrocardiogram waveforms. Analog to digital converter, a device for converting analog information such as temperature or electrocardiographic waveforms into digital form for processing by a digital computer, also called a deconverter. Analog, see analog. Analogy, Greek analogous, similar to agree in function or form, but different in structure or origin. Anal orifice, Latin orificium, an opening. One, the external opening at the end of the anal canal. 2. The anus surrounded by the anal sphincter.